three classes. So today's class will focus on syndromic diseases. Syndromic diseases means syndromes which are associated with the, like pneumonia, urinary tract infection, meningitis. Then subsequent classes will be with the individual organisms. So I have organized the class as such that we'll be discussing about bacteria, followed by the virus, then the fungus, and the parasites. So today we'll be discussing about a main clinical syndrome such as pneumonia or gastroenteritis or meningitis. So this is the overview of infectious diseases. So we have infection which ranges from the brain till the uh, to the body and to the musculoskeletal systems. So the most important for us from MRCP are the meningitis, then the pneumonia, and skin infections, and the food poisoning. So we'll be discussing about in detail about these conditions. So before that, we'll be talking about how we name the bacteria. So bacteria are classically divided as gram positive and gram negative based on the stain, gram stain. Subsequently, it can be classified based on the morphology. So we have cocci, which is like a small dot-like structure. Then we have bacilli, which are little elongated. So we have some classical organisms which have uh, um, features morphologically, special features which can cause, which are associated commonly with the infections. For example, gram-positive cocci, what commonly seen in clinical practice is staphylococci and streptococci. Group D streptococci is called as enterococci. So if you come across enterococci, it is also a subgroup of streptococci. Then we have gram-negative cocci. They're Neisseria meningitidis, or also called as meningococci. Then we have Neisseria gonorrhoeae, also called as gonococci. So these are the classical gram-negative cocci. Next, we'll move to bacilli. What are the gram-positive bacilli? So we would, in clinical practice, see predominantly gram-negative bacilli and a gram-positive cocci. But we should also remember some gram-positive bacilli. In them, we have actinomyces, Bacillus anthracis, Clostridium, diphtheria, Listeria monocytogenes. From exam point of view, you need to remember Listeria. Listeria is a classical gram-positive organism which is associated with meningitis in immunocompromised individuals. In the gram-negative rods, most of the organisms which you come across are gram-negative bacilli, such as Salmonella, Shigella, E. coli. All are classically gram-negative organisms.